Hello, everyone. Thanks for joining us for another Your Best You webinar series. We do these every month. We like to cover a broad range of topics, and we're glad that you can join us here today. Today, we're going to be talking about nose surgery with Dr. Stephan Finical. He's got a lot of really great information about the surgery itself and also some of his patients' before and after pictures. Dr. Finical is actually a member of the Rhinoplasty Society. This is a group of top surgeons throughout the world who specialize in noses, and they're considered innovators in their field. They're deeply committed to aesthetic and reconstructive nasal surgery. You can find out more information at rhinoplasty.org. Dr. Finical has been with Charlotte Plastic Surgery since 2001, but he actually came to us from the faculty of the Mayo Clinic. He is also known as a national speaker and educator on many different plastic surgery and cosmetic surgery modalities, both surgical and non-surgical. We're going to go ahead and start the webinar now. Just a few things to tell you before we get started. We will be sending you a recording of the webinar, and you can also find those recordings on our website, which is charlotteplasticsurgery.com. On your control panel, you will see an area where you can ask questions. Please chime in at any time during the broadcast. We will have a question and answer portion at the end. I'm going to hand it over to Dr. Stephan Finical, and we look forward to hearing your questions at the end of the broadcast.
Thank you very much, Leslie. What I'm going to start with is just to tell you what I wanted to do with this talk is allow people to understand what they need to know if they're considering a rhinoplasty, better known as a nose job. So that's what we're going to go through today. So when I see people that come in, what they usually don't like is they either have a dorsal hump, like the big hook nose, they have a bulbous tip to their nose, a big full tip, or their nose is simply too big for their face. And those are usually the underlying problems that people come in with. So this lady is an example of somebody who didn't like their profile, and she was concerned actually in a couple of areas, but her profile and many of the younger age group have so many pictures taken of themselves nowadays with everybody's phone has a camera on it and selfies, that I have a lot of people complaining what they look like in pictures. And this has been relatively recent, but you can see she has a dorsal hump. On the left side is her pre-op picture. The right side is after surgery. We've taken that down and smoothed it out. From a front view, you can see that she also had a wide full tip, and when we make the bridge of the nose smaller and narrower, we have to make the tip of the nose smaller so that it fits and it's in harmony. But you can really see that this really softened her features without making her look like a completely different person. Here's another lady who didn't like the shape of her nose. She has a strong dorsum, although it doesn't have as strong a dorsal hump as what we saw before. And she also has a sharp angle from her nose to her lips. And you can see when we bring down the dorsum some and allow that tip to rotate up, that's a much more feminine appearance of a nose. This lady the same way. She had a dorsal hump, some fullness, and allow that to come down and round out and allow the angle of the nose to come up is simply a much more feminine appearance of a nose. Here's somebody who didn't like that the bulbous tip, the tip of the nose was too large, and we narrowed it down. And we also narrowed her bridge some, but very little relative to the amount of narrowing we did with the tip. And this view shows you how wide and square the tip of her nose was and how we narrowed it down to make it much more feminine and aesthetically pleasing. Another example of someone who's got some strong dorsum, and actually you can see on her pre-op view that she has some sharp angles in the cartilages at the tip of the nose, and that bothered her as much as anything. And we softened that and really helped her gain her confidence. This is a very attractive woman, and obviously is older than some of the ladies that you've seen earlier. And she's an example of someone who, because she's very attractive, she personally didn't like her nose, but it's been told all her life that she shouldn't have anything done because it's she's attractive without having alteration. But she didn't like the width of her nose and the overall the bridge of the nose, the tip of the nose, and even the flare of the nostrils. And we've done narrowing to the nose, including narrowing the nostrils to allow those to rotate in more. So you can see some subtle changes, but we're taking somebody who's an attractive woman and making her more attractive, and particularly to herself where she was self-conscious. There's a young lady with a dorsal hump, again, the sharp angle at the tip of the nose to the lip, and we've taken down that strong dorsum, allowed the tip to rotate up, and really just given her a very nice feminine profile. There's a very attractive young lady who had a wide nose both in the bridge and in the tip, and we've narrowed the bridge, narrowed the tip, and just softened that nose. And now her nose is not her outstanding feature of her appearance, but you can see by taking the real focus off of her nose, it makes her eyes and lips really pop. And you can see on her profile, she had a very strong dorsum, perhaps a kind of a harsh look, where now with the dorsum taken down, just a much friendlier appearance. This young lady had a dorsal hump on the bridge of her nose and really just some poor aesthetic lines along the bridge of her nose. And what we like to see post-operatively is if we follow a line from her eyebrow right down the edge of her nose to the tip, it's one smooth line through there. And that's what we've achieved in her post-op on the right side, where she's got a nice smooth line where we took away the bridge. And you can see that in the lateral as well, that she has a nice smooth nasal dorsum. This is a young lady who had several fractures to her nose. It had been broken more than once and healed with a very large callus and a lot of thickness and width to the bridge of the nose. And post-operatively, what we've done is we've taken that down, narrowed the bridge of the nose, and made the tip of the nose really match the new narrower bridge. And here's her lateral, and you can see the large bone callus. Whenever we break a bone, we heal by adding more bone to it, and she had really developed a very large bone callus. This is a young lady who really just didn't like the dorsal hump of her nose, and we took that down and narrowed the tip so that somebody with these very fine features, it's much more balanced with her overall facial features to have the smaller nose. Her nose was simply too big for her face. And here you can see on profile again, achieving more feminine lines where the tip of the nose projects slightly beyond the bridge of the nose. The tip is slightly rotated and overall in much better balance with her face. Again, another lateral where somebody has a strong dorsum, the tip is rotated down. We've taken that dorsum down and allowed the tip to rotate up, and just puts her nose in much better harmony and makes the appearance of not only more feminine, but a less harsh appearance. So the procedure that all those people had is what's called an open rhinoplasty, and that's done by making a small incision between the nostrils and then essentially being able to raise the skin off of the substructures and adjust the cartilages of the nose underneath so that then the skin can be laid back over. All of these procedures are done as outpatient. As far as the recovery is concerned, somebody who wakes up from a full rhinoplasty typically has some packing in their nose overnight. This is soft Vaseline gauze. It easily slides out the next day, but overnight, a person will breathe through their mouth. They'll feel a little bit dry and they'll feel a little bit stuffy. Once the packing comes out of the nose and they're breathing through their nose, they'll feel a lot more comfortable. They'll have a splint on their nose and stitches underneath, and the stitches come out and the splint comes off 1 week after surgery. At that time, they're going to have probably a little bit of bruising below their eyes. They'll still be a little bit swollen, but usually that's a time you can get back to socialization. So at the second week after that, they're really back to all socialization. For young ladies, they'll maybe have a little bit more makeup on or foundation than they're used to try and cover up maybe a little bit of bruising that may be residual by that time. But usually about half the swelling in the nose is gone in the first 2 to 3 months. The rest of the swelling takes the rest of the first year really to go away. So I follow patients for an entire year after the surgery. If you're going to prepare for the surgery ahead of time, you want to maybe make sure you have some decaffeinated beverages on hand after surgery, just so that you can get your fill of waters and hydration without being nauseated. The first night, you're going to be breathing through your mouth, so you'll feel very dry. And so it's important to stay hydrated. So you maybe pick up some popsicles or Jello, maybe some throat lozenges, chapstick on your lips, because you'll be breathing through your mouth and be dry. Usually ice water with a bendy straw at the bedside. Your upper lip can have some numbness after surgery, so you do have to be careful with hot beverages that you don't injure yourself. And certainly keep ice on hand. It helps with a dry mouth, but it also, if you place an ice pack on the back of your neck, it can stop any little oozing or dripping that you might have from the nose surgery. In preparing for a rhinoplasty, depending on age, sometimes we ask for medical evaluation and testing. Usually in the younger age groups, that's not necessary. We may ask you to adjust medications or stop taking aspirin, ibuprofen, Motrin, those kind of things before surgery. Sometimes herbal supplements or fish oils, for example, can increase bleeding. And for sure, we want you to stop smoking. We'll give you special instructions on what to do the night before surgery and the morning of surgery in preparation. Your rhinoplasty will be done under an anesthetic. Here it's an all intravenous anesthetic, so you're not inhaling gas and you're not going to be sick to your stomach. And we'll be very careful with your postoperative care and follow-up, and you'll have those instructions well ahead of time so you can plan your schedule. After surgery, I often tell people, cut your hair or get highlights or something a little different, so that if someone just casually says, hey, you look a little different, you can say, yeah, I got a new haircut. And that way the question is asked and answered and they're on to something else. You will want to sleep with your head elevated for a week, and that doesn't mean that you have to sleep sitting just bolt upright. But typically what we want to do is have somebody's head above their heart level, just for drainage, so that the swelling can drain down. Most people are not driving the week that they have a splint on. As soon as the splint comes off, they're usually, if they're off their pain medicines, which they usually are, they're ready to return to driving. So in just repeating, the packing is removed the next day. The splint stays on for a week. We really ask you not to bend over the first week. I'd rather, if you drop something on the floor, squat to pick it up rather than bend over. Anything that really makes the blood rush to your head, you want to avoid. And then sutures are removed also at a week. So as far as timing in recovery, you really want to hide out for a week and rest at home. The second week after the splint's off, you can apply makeup over any area of bruising, and you'll feel comfortable going out. And an example is going to the grocery store and not having people stare at you. If you're concerned with people that know you and you don't want them to see you, you probably want to skip those people for a couple weeks. I always tell patients to plan to skip church for 2 weeks in a row. As far as events, and a lot of times people are getting prepared for events such as a family wedding, a class reunion, a big vacation that they've planned. If that's the case, give yourself a minimum of a month to recover from the surgery before you might involuntarily have your picture taken at one of those kind of things. Most of the swelling, as I say, is down or about half of it's down in the first 2 to 3 months. So if you can time it up to give yourself the maximum recovery before you get your picture taken. Many of you may have heard of a liquid nose job, and just for completeness, we'll talk about that. It is a quick in-office procedure. We use an injectable filler. There's essentially no downtime. The results are immediate and they last a year. So what do we do with that? We can disguise a dorsal hump some with a filler, or irregularities or contour problems can be covered with that. And here's an example where a young lady has a filler placed at the top of the dorsum of her nose, or the bridge of the nose, so that it fills in the space so it doesn't look as humped, and essentially on the right side you'll see that her nose looks straight. One of the shortcomings of this technique is that you can only add to the nose, you can't take away. Common add-on procedures that we do while people are asleep include fillers to the lips or the chin, or even Kybella to the submental area. While someone's asleep is a great time to do a lip injection, because they get the benefit of the anesthetic, and we can do a very accurate job injecting. So there's an example of before on the left. On the right, you'll see 1 week after a Volbella lip injection, which is a hyaluronic acid kind of a product, but it's very soft and it lasts for a year. Here's another example. This is a Juvederm, another hyaluronic acid product, but this is an example of lip enhancement 1 week after. Kybella is an injectable that dissolves fat. Here's one treatment 6 weeks post-injection. You can see that this young lady, who is obviously of ideal weight, has just an extra volume under her chin, and we've been able to eliminate that with a single treatment of the Kybella. And here's another view of that same person where you see the fullness is just taken out from underneath. So I like this quote from Jeff Bezos, who's now the richest man in the United States since he owns Amazon, or a big part of it. But I think this carries true. We see our customers as invited guests to a party, and we're the hosts. It's our job every day to make each important aspect of the customer experience a little bit better. And we certainly try and do that at Charlotte Plastic Surgery, and I'll welcome questions.
Thank you so much, Dr. Finical, and thank you to everyone who has been sending in your questions. If you have not done so, please send us those questions. Any that we do not get to today, we will follow up and email you directly a response to your question. The first question we have for Dr. Finical is, when can I get back to exercise?
Most people are able to get back to exercise after about 2 weeks. And the reason for that is that we want you not to raise your blood pressure for the first couple of weeks after surgery, because it will impact your swelling. So usually after about 2 weeks, people can ease themselves back in over the ensuing 2 weeks at that point, so that by a month after surgery, they're doing most things that they were doing the day before.
Wonderful. And the next question is, will it affect my sense of smell?
It does not. Your sense of smell is actually way up at the top of your nose. And although you'll be packed overnight, the first night you won't have any sense of smell just because your nose is packed. But as soon as the packing comes out, then your sense of smell comes back, and there's no effect of that in the long run.
Great, thank you. And we have another question here. What if I get hit in the nose after my surgery?
I've been doing this for over 20 years, and I've had one person in my experience that has gotten hit in the nose in the early postoperative period with enough force to actually need to be readjusted or corrected. It's very rare. Of course, after surgery, you feel like everything is hitting your nose or touching your nose. But it's very, very rare to have something actually hit it hard enough to move. By about 2 weeks, things are pretty solid again. So in the early post-op, the first week you've got a splint on anyhow. The second week, you will not have the splint, but you'll be solidifying pretty well. And by 2 weeks, things are pretty darn firm. So it's very rare to have that kind of a problem.
Great. Thank you so much. That is all the time that we have for questions right now. But again, please send your questions in and we will get them answered for you. Dr. Finical will respond and we'll send you an email. So how you can keep in touch with us, you can always call to schedule a complimentary consultation and speak with one of our physicians. You can also visit us at charlotteplasticsurgery.com where you can view additional before and after pictures, get to know our surgeons a little bit better, and sign up for our monthly newsletter, which will inform you about our monthly webinar series, different videos that we might have. You can follow us on Facebook and Instagram to see industry tips and tricks and just to keep up to date with everything that we have going on here. So thank you again for joining us today. We're so glad that you got to attend, and we look forward to seeing you at our next Your Best You webinar installment. Thank you.